Guess we'll start. Morning, everybody. Thank you for being here. My name is Dr. Bill Paul, and I am Director of the Metro Public Health Department, and welcome to the future Lentz Health Center of the headquarters of the Metro Public Health Center. We're very excited about this new building. The Health Department's mission is to protect and improve health and well-being for everybody in Nashville. And that is a big mission. There will be a lot of different things going on in this building. We're very excited about how this building will help us do our job better. We'll give our customers a better experience. We'll be green and efficient, but also that it will be from the moment you walk in the door, it'll be a healthy building. And so what we're really highlighting today is not everything that we're going to cover at the ribbon cutting, but we're highlighting what's been incorporated into this building that'll make it a healthy building. And we're really excited to show you that. So once we've finished here, we'll make 4 stops. We'll go up and look at the walking track, the skywalk. We'll look at the walking trail, the future walking trail outdoors. We'll look at the teaching kitchen, talk about that a little bit, and come back to the lobby and point out some of the healthy features of the lobby. So we'll basically have 4 stops. We'll be out of here in about half an hour. Again, we're excited about this, and we're glad you're here. And I think I just want to introduce a few folks that are really critical to this whole process. First of all, my board chair, Mr. Bill Hance, is here. Sam Hazen, the President of Operations for HCA. Greg Stein, who's our project manager from HCA. Ed Fishbow, the Public Information Officer for HCA. And then from Gresham Smith, we have Ann Trent and Steve Kolinsky. And then John Thayer from Bell Construction. There are other folks, and I will introduce the mayor, and then I'll introduce Council Member Edith Langster in a moment. But now I'd like to introduce the mayor of Nashville, Karl Dean.
Well, thank you, Bill. First, let me say that this does not represent any change in my football loyalties. On every Saturday but one, I root for UT, but there's one with the gold and yellow I would root for before UT. I want to thank HCA, first and foremost, for working with Metro in this unique public-private partnership that started with the need for a new public health center and led to a unique opportunity for us to receive a state-of-the-art facility and HCA to receive space to expand their Centennial campus. HCA is building this new Lentz building based on the current and future needs of public health in Nashville. There is perhaps no organization more informed about how to build a world-class health facility than HCA. Once complete, Metro will take ownership of this building, and HCA will become the owner of the current property located at 311 23rd Avenue North. There were 2 main principles established at the beginning of the design process. 1, set an example for healthy and active living, and 2, act as a good steward of both the environment and of the taxpayers' dollars by providing a first-class facility that utilizes sustainable and smart building design solutions. There will be easier access to the Lentz building for those riding a bus and even those riding a bicycle. There will be a covered bus stop on Charlotte in front of the building, a bike lane on Charlotte, and we are in sight of the 28th Avenue connector, which also serves as our city's first cross-town bus route, the University Connector. The new Lentz is being built to LEED Silver standards, which we have done with many of our new Metro buildings, including the Music City Center and our new branch libraries and police precincts. I'm looking forward to taking this tour today and seeing how the 2 design principles are becoming a reality. Thank you. And I'll put my hat on now.
Take mine off. Thank you, Mayor Dean. One of the things that's really important to us in public health is that we're connected to the community that we live in, and this new building is actually in the same council district as our old building is. But when we first started talking about this building, we wanted to talk to members from the community, and Councilmember Edith Taylor Langster from the 21st District helped us convene some folks to really listen and get some ideas about some things we wanted to incorporate into the design. So we appreciate that, and I just wanted to give Councilmember Langster a moment to say a few words.
Thank you very much, and good morning to Mr. Hans and to HCA, especially to Mayor Dean, who really made this possible. Thank you, Mayor, again. We are very glad that we are staying, that you're staying in the 21st District. Of course, the other location is in the 21st District, and now this one is. Dr. Paul asked me to bring some ministers together so that they might talk and give input, and we had a very delicious lunch, thank you. But we are just happy to be here still in the 21st District. We welcome you with open arms, and I'm ready to cut the ribbon. Thank you.
Thank you, Councilmember Langster. Also, I wanted to introduce Mr. Sam Hazen, who is the President of Operations for HCA. Again, I agree with the Mayor. We're very grateful for your role in building this and give you an opportunity to say a few words.
Thank you, and good morning. And on behalf of the colleagues over at HCA, we're proud to have been a part of this public-private partnership. We think anytime we can participate in such events, it really creates a win-win situation for the citizens of Nashville as well as for our company, and so we're very proud to be a part of it. It's an incredible building. I'm proud of our team and what they've done with it, and we look forward to the opening in this summer. Thank you very much.
One of the healthy features is a walking track, 1/8 of a mile around the perimeter of the building. For employees during breaks, during meetings, or just getting from place to place, it's been designed for physical activity to be incorporated into the daily work. This is environmental health here, so open office environment with cubicles and a few offices. We'll talk a little bit more about the monumental stair here, but one of the ideas here was when you walk in the front door, a lot of places what you see is the elevator. And so the easiest thing to find to go up and down is the least physically active. And so what we did is kind of reverse it a little bit, make the most obvious way for most able-bodied people to go up and down, to take the stairs, and make that a central part of the lobby. And so Gresham Smith designed this monumental stair is really kind of a key feature of the entryway. There are elevators. This is fully ADA compliant. Offices for different health department officials. Right. The third floor is going to be largely environmental health, finance, administration, and epidemiology and data analysis functions here. So it's largely our own employees, largely administrative functions and regulatory. So our food inspectors will begin their day up here. The hotel, motel inspectors, a whole variety of people, clean air, air quality control. The landings on the stairs are big, so that it's another way of just kind of highlighting the stairs as an attractive place for people to go up and down. Room combined with a teaching kitchen. We have pictures of an example of a teaching kitchen. This isn't the actual design, but this is basically the teaching kitchen at our WIG site in South Nashville. So what you'll see is really kind of a regular kitchen setup with a big mirror so that people can watch demonstrations of healthy cooking being made. This will be a big step up for our WIG program, where we have to provide nutrition services, nutrition education for families of half the children born in Nashville. So teaching kitchen will also come in handy for our food inspectors as they learn how to inspect a kitchen, and they're also a conference space here. There's just an example of a healthy amenity that we're able to add compared to where we were before.
And what's your audience for the teaching kitchen?
Largely it'll be WIC, Women, Infants, and Children, the supplemental nutrition program. Families get vouchers that help supplement and enrich their nutrition at home. And when they come in, at least twice a year, they get a nutrition education as part of the visit. Yes. So we came in off of the parking lot entrance, but there is a main entrance off Charlotte where the artistic bike racks will be out there. There'll be a bus stop. I'm forgetting what else. There'll be a nice plaza out on Charlotte as well. So we'll head out there and go back to the lobby. Again, the idea of walking in the main entrance is to make the staircase irresistible for the people who can use the stair. It's the easiest and most obvious way to go up and down. If people need an elevator, they are completely accessible. One of the things as a very creative way of enhancing people moving and people using the stairs is that the public art that's been commissioned for this space is really on this big frame around the staircase and hanging up in between the stairs. It will be a series of smart glass pieces that they transition from clear to opaque based on motion. So we have a huge camera up there, and when people are using the stair, the art will actually flicker and move as people move up and down. So we're really looking forward to that as kind of an example of how sort of making the stairs even more inviting for people to go up and down. Obviously, climbing stairs isn't all we do at the health department, but encouraging movement throughout the workday. We're trying to do whatever we can, both for our employees and for our customers, to incorporate some physical activity into their experience here.
It's consistent with the great work you've done on healthy national activity in terms of getting people to walk more, use the stairs, bike, encourage movement, get people healthier, which has got to be in your top health challenges facing our city.
It sure is, and I think it kind of fits with the vision you've been setting, because you've been trying to create places where it's easier for folks to be healthy all over Nashville. And it's kind of an honor to be part of this overall movement in Nashville towards making healthy choices, easier choices. We've got just out the front door, as I mentioned, the Music City Bike Rack. So we are on the route from Percy Morning to Percy Creek for anybody who's needs to stop at the health department for your food shop while you're out through a day-long bike ride.
How important was it to stay in this area with the medical campuses nearby?
I think it's a great advantage for us to be on the medical campus. You know, Nashville is really the healthcare capital of the world, and HCA is a big part of that, and so there's kind of a synergy there. We would like for Nashville to be the healthiest city in the world, and so I think this building will help us get one step closer to that.
Underscoring the importance of Nash Vitality and the work that Bill's done with that, it's just critical to get people in designs of buildings and how they approach day-to-day life, thinking about being more active. If you have more people biking, that's a great thing. If you have more people walking the steps, that's a great thing. And being here in a major medical corridor is a great asset. And I can't underscore the importance of the public-private partnership that we were able to do with HCA. Again, I think it's incredibly generous and community-minded of the company to take this step, and I think it's a win-win for both the city and for them. But this is an exciting project, and the building itself, you know, if you notice all the curves and things, I mean, the idea is it suggests activity, it suggests movement, and that's what Dr. Paul and myself have been talking about for about 6 years now. So it's good. This would be a great improvement for what the citizens in Nashville will be offered in terms of public health care.